Your doctor cannot help you if you cannot describe what is wrong. Today, we'll walk you through every word, phrase, and question you need so that nothing gets lost the next time you are sitting in that examination room. Okay, so Emma, let me ask you something. Has anyone ever handed you a medical form, like 5 pages long, and you just stared at it and thought, I have absolutely no idea what half of these words mean?
Oh, every single time. Even for me, and English is my first language. Some of those forms are intense. They ask things like, do you have a family history of cardiovascular disease? And you're just sitting there in the waiting room with a pen thinking, does that mean heart stuff?
Exactly. And if that is confusing for us, imagine how it feels when English is not your first language. You are already nervous because you do not feel well, and then on top of that, you have to communicate everything clearly to a stranger in a language you are still learning. That is a lot of pressure.
It really is. So today, we are going to go through the whole doctor's office experience from start to finish. We're going to talk about how to describe how you're feeling, how to ask the right questions, and how to actually understand what the doctor tells you to do afterward.
And we're going to keep it real. This is not a textbook. We're just going to have a normal conversation, the way we would talk about it with a friend. And you can pick up all the phrases naturally just by listening.
That is the whole idea. All right, let's start at the very beginning. You don't feel well. You decide you need to see a doctor. What is the first thing you do?
You call the clinic or the doctor's office to make an appointment, and that phone call alone can feel intimidating. So here's what it usually sounds like. You call, someone picks up, and they say something like, "Thank you for calling Riverside Medical. How can I help you today?"
And then you say something simple like, I would like to make an appointment to see a doctor. Or even shorter, I need to schedule an appointment, please.
They will probably ask you a few things. They might say, are you a new patient or an existing patient? A new patient means you have never been to that clinic before. An existing patient, or sometimes they say returning patient, means you have been there before and they already have your information on file.
Right. And then they might ask, what is the reason for your visit today? That just means, why are you coming in? What is wrong? And you do not have to go into a lot of detail on the phone. You can keep it short and say something like, I have been having a bad cough for about a week, or I have a pain in my lower back, or I have been running a fever.
Simple, direct, just enough to give them the idea. They will then give you a date and time, and you confirm it by saying, that works for me, or that sounds great, thank you.
Okay, so now you have your appointment. You show up at the clinic. The first thing that usually happens is you check in at the front desk. You walk up and you say, hi, I have an appointment at 2 o'clock. My name is Emma Collins.
And they will verify your name, maybe ask to see your ID, and ask for your insurance card if you have one. If you do not have insurance, you can say, I do not have insurance. Can you tell me what the cost will be?
That is such an important phrase. A lot of people do not know they can just ask that up front. You are not being rude. It's completely normal to ask.
Absolutely. And then you fill out some paperwork. This is where it can get a little overwhelming, like we were saying. The forms usually ask for your personal information, your medical history, and a list of any medications you are currently taking.
If you see a word on the form that you don't understand, do not be embarrassed to go back to the desk and say, excuse me, could you help me understand this question? They deal with that all the time. It's totally fine.
All right, so now you are in the waiting room. Your name gets called. A nurse or a medical assistant brings you into an exam room. This is where things start to get more specific. They're going to check your vitals first. Vitals means your basic health measurements, your temperature, your blood pressure, your heart rate, and sometimes your weight and height.
The nurse might say, can you step on the scale for me? The scale is the thing you stand on to measure your weight. Or they might say, I'm going to take your blood pressure now, and they put that cuff around your arm.
If you do not understand what they are doing or why, you can always ask, what is that for? Or what does that mean? Medical professionals expect questions. They are not going to judge you for asking.
Okay, so vitals are done. You sit on that crinkly paper on the exam table, and the doctor comes in. This is the most important part of the whole visit, describing your symptoms. A symptom is a sign that something is wrong with your body. things you feel or notice.
And doctors are trained to ask specific questions, but you can also be proactive, meaning you can start talking before they even ask. A simple opener is, I have been feeling really unwell for the past few days, or something has not been right and I wanted to get it checked out.
Then you get into the details. Let's go through some of the most common symptoms and how to describe them in English. Let's start with pain, because pain is one of the most common reasons people go to the doctor.
If you have pain somewhere, you want to describe 3 things: where it is, what it feels like, and how bad it is. So for location, you say things like, I have a pain in my chest. My lower back hurts. I have a pain behind my left eye. My stomach has been hurting.
For what it feels like, there are some really useful describing words. You might say the pain is sharp, which means it feels like a stab or a cut. Dull, which means it is a low, steady ache. Throbbing, which means it pulses like a heartbeat. Burning, which means it feels hot. Pressure, which means it feels like something is pressing down on that area.
So you could put it all together and say something like, I have a sharp pain in my lower right side, or I have a dull, throbbing headache that has been going on for 2 days.
And for how bad it is, doctors often ask you to rate your pain on a scale of 1 to 10. 1 means barely noticeable. 10 means the worst pain you have ever felt. So they might say, on a scale of 1 to 10, how would you rate your pain? And you just give them a number and maybe add a little context, like, I would say about a 6. It is bad enough that it is hard to concentrate.
Now let's talk about some other common symptoms. If you feel sick to your stomach, you say, I feel nauseous, or I have been feeling nauseated. If you actually got sick, you say, I have been vomiting, or more casually, I've been throwing up.
If you have a cold or a respiratory issue, some useful phrases are, I have a runny nose, my nose is congested, or I am congested, which means blocked up. I have a sore throat, which means your throat hurts. I have been coughing a lot, or I have a persistent cough, which means it will not go away.
Persistent is a great word to know. It just means ongoing. It keeps happening. It is not going away on its own. You can use it for a lot of symptoms. I have a persistent headache. I have been having persistent stomach pain.
What about fatigue? That's a big one.
Yes, fatigue just means extreme tiredness. You would say, I have been feeling really fatigued, or I'm exhausted all the time, even when I sleep enough, or I have no energy. The doctor might ask, is the fatigue constant, or does it come and go? Constant means it's always there. Come and go means sometimes it is there and sometimes it is not.
That phrase, come and go, is used a lot by doctors. You might also hear, is the pain constant or does it come and go? And you answer, it's pretty constant, or it comes and goes. It's worse in the morning.
Another important thing to describe is when the symptoms started and whether they are getting better or worse. So you can say, this started about 3 days ago. I have had this for about 2 weeks. It has been getting worse, or it has been getting better, but it is still there.
And if there's anything that makes it better or worse, mention that too. For example, the pain gets worse when I bend over, or it feels a little better when I take ibuprofen, or eating makes the nausea worse.
Ibuprofen, by the way, is a common over-the-counter painkiller in the U.S. Over-the-counter means you can buy it without a prescription, without a doctor's permission. Brands like Advil or Motrin are ibuprofen. Tylenol is a different kind, called acetaminophen.
Good to know. Okay, so now let's talk about asking questions. A lot of people feel shy about asking their doctor questions, but this is so important. The visit is for you. You deserve to understand exactly what is going on and what you are supposed to do.
Some great questions to have ready are, can you explain that in simpler terms? You can absolutely say that if the doctor uses a word you do not understand. They will not be offended. They will appreciate that you want to understand.
Another one, what do you think is causing this? Or, what does this diagnosis mean? Diagnosis is the word for the conclusion the doctor reaches about what is wrong with you. So if a doctor says, my diagnosis is that you have a sinus infection, a sinus infection is what is wrong with you.
You can also ask, is this serious? Or should I be worried? And what happens if I do not treat this? That one's really useful because it helps you understand how urgent the situation is.
And, of course, what are my options? Sometimes there's more than one way to treat something, and it's okay to ask about all of them before you decide.
Now, let's talk about understanding the doctor's instructions. This is the part where a lot gets lost. You nod along, you leave the office, and then you get home and realize you're not exactly sure what you're supposed to do.
So listen for a few key things. First, your prescription, if you get one. A prescription is a written order from the doctor for medication. The doctor writes it, you take it to a pharmacy, and they give you the medicine. The pharmacist is the person at the pharmacy who prepares and gives you the medication.
When you pick up your prescription, the label on the bottle will tell you how to take it. Some common instructions you might see or hear: take 1 tablet twice a day. Twice a day means 2 times a day, usually morning and night. Take with food means eat something before or while taking the medication. Do not take on an empty stomach means the same thing. Take the full course means finish all the medication even if you start feeling better before it is gone. This one is especially common with antibiotics.
Antibiotics are medications that fight bacterial infections, and take the full course is really important with antibiotics, because if you stop early, the infection can come back stronger.
You might also hear avoid alcohol while taking this, or this medication may cause drowsiness, which means it might make you feel sleepy. Do not drive while taking this could follow that one.
And in terms of follow-up, the doctor might say, come back in 2 weeks if things have not improved, or I want to see you again in a month, or if the symptoms get worse before then, come back sooner or go to urgent care. Urgent care is a clinic you can go to without an appointment for things that need attention soon but are not a full emergency.
An emergency room, or ER, is for serious emergencies. Difficulty breathing, severe chest pain, a serious injury. Those are the situations where you call 911 or go straight to the ER.
Okay, let's do a quick recap of the key phrases we covered today, because there were a lot of good ones.
For making an appointment, I would like to schedule an appointment. I am a new patient. The reason for my visit is.
For describing pain, I have a sharp pain in. It is a dull ache. The pain is throbbing. On a scale of 1 to 10, I would say it is a 7.
For describing other symptoms, I have been feeling nauseous. I have a persistent cough. I have no energy. It comes and goes. It started about a week ago.
For asking questions, can you explain that in simpler terms? What do you think is causing this? Is this serious? What are my options?
And for understanding instructions, take twice a day, take with food, take the full course. Come back if symptoms get worse.
Those phrases will take you so far. You do not need to be perfect. Doctors and nurses work with patients every day who speak all kinds of different languages at all kinds of different levels. They want to help you. They will work with you.
And honestly, even just showing up and trying, even if you stumble over a word or have to repeat yourself, that takes courage. Give yourself credit for that.
Absolutely. The more you practice these phrases, even just by listening to conversations like this one, the more natural they will feel when you actually need them.
That is what we are here for. If you want to keep building your everyday English, keep listening. We cover a new topic every single episode.
Before we go, if today's episode got you thinking about your English journey, you're going to want to hear our episode called The Truth About Learning English, where we get into why so many learners feel stuck even after years of studying and what actually works.
It's honestly one of our favorites because we talk about our own struggles learning French and Spanish, so it feels very real. This video is on the left side.
Bye, everyone.
Bye.